Hi, my name's Tim Broady. I'm from the University of New South Wales, and I'll be talking today about a project that looked at supporting carers to prevent abuse, neglect, and exploitation of older people and adults with disability. Just as a bit of background, this project was funded by the New South Wales Ageing and Disability Commission, who have found that carers are often the subject of allegation in many of the reports they receive. So this creates a complex relationship between the ADC and carers, where on the one hand, they're looking to support carers in their caring role, but also hold to account those who do abuse, neglect, and exploit older people and people with disability. So in this project, we looked at data from existing reports that they had received to looked at informing how to handle future reports, ways of better supporting carers, opportunities for early intervention and prevention, and also appropriate and effective communication with carers. So on this slide, you can see some of the risk and protective factors that were recorded in case files, particularly those related to carers. You can see up the top there that it was only in 8% of reported cases that the carer had any formal supports in place at the time of the allegation, and only slightly more, 13%, had informal supports in place. You can see that 33%, so 1 in 3 cases, there was clear evidence of carer stress. And keeping in mind that in these case files, this is what was reported. So the actual numbers may actually have been a bit higher. But you can see that there were a substantial number of cases where carer stress was a contributing factor. And also important to point out that over 60% of cases, there were other factors that weren't listed in any of these categories, which so really started to highlight some of the complexity and range of different things that can contribute to these situations of allegations of abuse or neglect. We also looked then at the ADC's primary action in response to these reports. You can see overwhelmingly that early intervention and resolution was the main action undertaken by the ADC. So on this slide, the actions are broken down according to allegations of financial abuse, neglect, physical abuse, and psychological abuse. But even so, you can see that that early intervention and resolution was by far the top action taken. This was then followed by community support, where between 20 and 30% of cases, that was the primary action taken, followed by being closed over after preliminary inquiries. So overall, you can see that the main action taken by the ADC was typically very supportive of all parties involved in these situations. So to briefly summarise a quite complex project, really what we found was that the data in these case reports highlighted the complexity in caring relationships, as well as the complexity in allegations of abuse, and also in even being able to identify carers within case reports. We found that there were many different issues leading to situations of abuse or neglect being reported, and that caring demands further complicated these issues. Cultural and language factors may have contributed to these situations in many cases, as well as service access or not being able to access services, and previous negative experiences were highlighted as significant issues contributing to these situations. In about 1 in 5 cases, carers were unaware of their actions that would constitute abuse. So it wasn't a situation of people being malicious or necessarily doing anything wrong. It was more that they just weren't necessarily aware that their actions would constitute abuse or neglect. And as I mentioned, the ADC primary actions were typically very supportive. So some of the main recommendations coming from this project, to develop resources for carers to explain what constitutes abuse, neglect, and exploitation, and also to encourage carers, service providers, and ADC staff to be able to recognise and respond to carer stress when it occurs. It's important to provide information and resources to assist carers and the people they care for in navigating the service system, but also to develop some messaging that addresses reasons why carers or care recipients might be reluctant to access services at all. It's also important that some training and resources are developed to support families and service providers to resolve conflicts within these family situations, and also to report abuse when that is appropriate and necessary. And then finally, to develop a targeted information campaign about the holistic support and the advice offered by the ADC. So thank you for listening to this presentation, and please get in contact with me if you have any further questions. Thank you.